Between clinic shifts and parenting chaos, who has time to deep dive every pediatric journal? I'm Dr. Matt, pediatrician and fellow parent, and each month I decode the latest child health research so you don't have to. This debut episode digs into social media's mental health toll, a silent iron deficiency risk at birth, and Australia's mounting RSV defences. Plus, a fitness and focus-based myth busted at the end. I break down the evidence, its strength, and practical takeaway messages for clinicians and parents alike. Hit that subscribe button if you're ready for evidence you can trust. 1 in 3 tweens see mood dips after extra screen time. First up, we're covering an analysis from the UCSF of 12,000 9 and 10-year-olds in the ABCD study. When kids bumped up their social media use, depressive symptoms jumped 35% later, and crucially, kids who felt down didn't scroll more afterwards. The timeline points in one sobering direction: screen time first, then depressive symptoms. This is emerging evidence. It is a large longitudinal observational study, so we can't draw causal links, but the timeline is compelling enough to shift our guidance. This fits with my clinical intuition and is a real call to action. The Adolescent Brain Cognitive Development Study is the largest long-term investigation of brain development and child health ever conducted in the United States. It follows nearly 12,000 youth aged 9 to 10 at enrollment and will track them for at least a decade. Watch this space for more emerging actionable data. Here in Queensland, the emerging digital wellbeing programs now set up in primary schools couldn't be more timely. Clinicians, ask about screen time at year 5 and 6 checks, even if mood looks fine. Parents, set digital boundaries before high school. Teach emotional check-ins, not just time limits. This doesn't cast social media as the villain, it tells us when to intervene. Early conversations can change the story. Over 1 in 10 term babies lack critical iron at birth. At this year's Pediatric Academic Society's annual meeting in Hawaii, one group presented findings that 10.6% of newborns had low iron stores, rising to 13.5% in babies of diabetic mothers and 11.7% in those born to anemic mums. Yet here in Queensland, neonatal iron screening isn't routine, potentially leaving gaps in care, especially for remote and First Nations communities. Regarding the strength of these findings, this is only conference data. It's biologically plausible but not yet peer-reviewed. However, it points to an especially important consideration we may be neglecting in the quest to achieve equity in First Nations health. In 2021, the children developmentally thriving gap was still wide at 34% versus 56%, despite slow gains. Clinicians, ask about anemia and diabetes at discharge and at 6 weeks checks. Regional or remote, do a quick finger prick point of care HB check, or send a capillary sample for a full blood count. Look for a hemoglobin less than 110 or microcytosis. For at-risk babies, consider starting oral iron at 1 to 2 milligrams per kilo per day prophylactically. Treat confirmed iron deficiency with 3 to 6 milligrams per kilo per day. See the attached RCH iron deficiency guide in the description below. Parents, if mum had low iron or gestational diabetes in pregnancy, ask your GP if your baby needs a simple iron check. Tiny tweaks now can fuel big gains later. Iron is essential for brain wiring. This could be a quiet driver of the developmental gaps we see in First Nations communities, and we've barely started looking. RSV prevention is here. Is your baby covered? Queensland's new RSV prevention program didn't come out of nowhere. In Western Australia, the REVIVE study showed nirsevimab cut RSV hospitalisations by over 88% in babies last winter. And a population-based analysis in the Medical Journal of Australia confirmed a dramatic drop in RSV admissions across WA in 2024. Riding on that success, on 1st December 2024, our Queensland Paediatric RSV Prevention Program began, offering free nirsevimab year-round to all eligible infants up to 8 months, including those who missed the maternal dose, preterm babies and Aboriginal and Torres Strait Islander children. Plus, pregnant women can get Abrysvo at 28 to 36 weeks, to protect newborns from even before birth. Year-round, open to all Queensland residents, no Medicare required. This is very strong evidence. It's backed by large phase 3 trials and global expert consensus. The science is solid. Now we need to make sure every family knows RSV prevention is on offer and give them every opportunity to take it up. Clinicians, discuss RSV prevention before 28 to 30 weeks, during antenatal visits. At birth or discharge, check infant eligibility for nirsevimab. It'll mainly be those not covered by maternal Abrysvo. Record each dose in the Queensland Health Red Book and update immunisation records. Parents, ask your GP, midwife or child health nurse if you or your baby qualify. Pro tip, almost everyone does. This quick step could prevent a lengthy winter hospital stay. The US and Europe are rolling out similar programs, but Queensland's already leading the way in paediatric RSV protection. If you want to go deeper on any of the topics we've discussed today, the best place to do that is on my Substack, Dr. Matt Peed. That's DrMattPaed. There, you'll find the full, in-depth child health brief with links to all the studies, my clinical notes, and a parent-friendly checklist to guide your next steps. It's completely free to subscribe, and the link is in the show notes below. And if you're listening to the audio version of this, you can watch the full video breakdown of all this research on my YouTube channel. Just search for Kids Health Decoded by Dr. Matt on YouTube or click the link in the description. Make sure to subscribe on both platforms so you can stay informed, not overwhelmed. If my child gets more exercise, they'll focus better, right? Does running equal sharper minds? A recent study published in BMC Pediatrics tested 62 10-year-olds' physical fitness, body composition, strength, speed, coordination, and aerobic capacity against executive functions like inhibition and cognitive flexibility. They found only trivial correlations overall, with a modest, inconsistent link between limb speed and inhibition. This is emerging evidence. It was a solid cross-sectional design, so no causation can be inferred. We need longitudinal data, but this study challenges our assumptions and opens better questions. Don't get me wrong, exercise is crucial for physical and mental health, but if attention is a concern, check sleep quality, emotional stresses, and possible neurodiversity. Don't just stockpile on the cardio. Let's stop guilt-tripping active kids who might need real moments of calm. Tailor your approach to each child's needs. That's your brief. Clear, calm, and clinically useful. Let's make evidence easier to trust together. And get ready, because next month we're launching our full monthly format for Kids Health Decoded. We'll be starting with our new segment, Decoding Your Feed, where we tackle the viral trends filling your social media, including the Sephora Kids phenomenon and the dangerous egg crack challenge. We'll follow that with the research Decoded, and finish with the deep dive, where we will decode one of the most confusing and emotionally charged topics for new parents, the tongue-tied controversy. I'll share my story and expertise about how I came to be part of the group that developed the New Zealand National Guidelines. It's a format designed to give you everything you need in one place. Subscribe now so you don't miss it. I'm Dr. Matt, pediatrician and fellow parent. See you next month. And remember, stay informed, not overwhelmed. The information in this podcast is for educational and informational purposes only and does not constitute medical advice. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by this podcast is solely at your own risk.